March 9th, the Waterloo Region Chronic Pain Initiative held a workshop at the University of Waterloo School of Pharmacy campus. The Waterloo Region Chronic Pain Initiative is a movement that provides awareness as well as educates the public about chronic pain. One of the speakers, Dr. Kim Moore, an expert on complex regional pain management, spoke about the impacts of chronic pain on the body and how to understand it.
They're trying to actually map in the brain what they're calling pain signatures. That actually, when you look at functional MRI pictures of the brain and where various spots light up when people are in pain, they're actually finding some pretty consistent patterns for people with fibromyalgia, irritable bowel syndrome, temporal mandibular joint syndrome, post-herpetic neuralgia, that actually there are imprints on the brain that they're starting to call signatures. And what these signatures have in common, something called central sensitization. I'll talk about that a little bit. It's the new buzzword in chronic pain. Gray cell damage, and actually even gray cells in your brain dying from being overstimulated.
Chronic pain is something that a lot of people, some medical professionals included, do not know very much about. Dr. Moore explained the difference between acute pain and chronic pain. Acute pain is short-term, while chronic pain is long-term, which often features other symptoms as a result.
Over a number of years, it really starts to affect the emotions. Depression, anxiety can cause major sleep disruption, sleep apnea. You can end up with heart disease, diabetes. There's this whole myriad of effects of chronic pain. If we don't treat chronic pain, it can become a big problem. So many things can happen over time.
In many cases, people with chronic pain prefer not to talk about it because of the things people say, like, "You don't look sick. Just get more exercise. It's all in your head." Cara Kelterborn, a registered psychotherapist, said it can be difficult for family members and friends to just stand by and watch while loved ones are in pain.
You're in a situation where you actually don't have control over being able to help that other person. There are certain things you can do. A lot of times people will think they know how to help someone, but they aren't necessarily always helping someone without that need being stated by the person in pain.
Lynn Cooper, president of the Canadian Pain Coalition, pointed out that the pain isn't necessarily visible.
I became involved with CPC because I'm actually an individual who lives with pain, even though when you look at me, it doesn't appear like I live with daily pain. And so I encountered a lot of the barriers, a lot of the stigma that individuals with pain encounter. And I wanted individuals to have a better road than I did. I wanted them to have better education opportunities to learn about chronic pain, to find pain management. I also wanted to make a difference so that our healthcare providers would become better educated and we could advocate for improved pain management within our Canadian health systems.
Pain is a very complex thing, and it's always changing. For some people, living with pain is a part of their everyday lives. For Spoke Online, I'm Jessica Hammer.